Again, thank you everyone for joining us for Mental Health America's Peer Partnership in Recovery and Social Inclusion webinar, Part 2. Today we are talking about the It's My Life Peer Partners Program, a social self-directed social explorations program. It's My Life Peer Partners is a program of Mental Health America. Mental Health America is the nation's oldest advocacy organization that addresses the full spectrum of mental health and substance use conditions and the profound impact that they have on public society. Established in 1909 by Clifford Beers, who himself was a person with lived experience, he experienced quite a few atrocities in the delivery system of mental health services. And one of his favorite quotes, and it's one that we believe in strongly here at Mental Health America, he said, "I must fight in the open." That was his response when his friends and colleagues told him that he should address his concerns privately and not speak about them publicly. And his response was, "I must fight in the open." Mental Health America successfully launched the It's My Life program through a pilot in the Northern Virginia area, and subsequently we have created the new Peer Partners model that we're talking about here today. This is a small introduction about myself. I am currently the Senior Associate of Peer Advocacy Supports and Services here at Mental Health America. I was one of the original life coaches for our pilot program and helped to develop the new Peer Partners model. Our program director, Patrick Hendry, who is Vice President here at Mental Health America, has an extensive history of mental health advocacy and education as well. He is the visionary behind the It's My Life program and has a huge background in self-directed care. He actually helped to found the first self-directed care program in Florida here in the U.S. So let's look at the purpose of the It's My Life program, and this may be a bit of a review for those who attended Part 1, but we're going to look at the purpose of the It's My Life program. This includes the original model and the Peer Partners model. So at MHA, we realize that social exclusion and isolation contribute to ill health. So in order to advance recovery and improve the lives of individuals with severe mental health conditions, It's My Life assists people in finding the power to reclaim their place in their community. So participants are accompanied in this program on their recovery journeys by trained life coaches who help them bridge the gap to a larger social world. It's My Life provides them with a safe place to learn and practice skills, particularly social skills, to prepare themselves as they move forward on their chosen recovery path. Social connection fits into the overall goal and journey of recovery. The traditional approaches such as medication and hospitalization, psychotherapy, and things of that sort have limited effectiveness when applied to the socialization and work aspects of folks with psychiatric disabilities. And so we designed It's My Life to help people build networks of friends and intimate relationships. And the point is to create a strong social support system, which I believe is essential to achieving and maintaining recovery. It also helps to increase self-esteem and self-worth to improve overall social functioning. What makes It's My Life different is our viewpoint on the difference between separation, integration, and inclusion. We don't believe that they're the same thing. They don't look the same, and for me, they don't feel the same. So the It's My Life program uses person-centered outcomes to measure the success of the services provided. People need to be more than just residents in their community. So we assert that completing activities does not indicate or reflect a positive outcome. For example, taking a group of people perhaps from a community mental health center, and taking them out, let's say, bowling. And everyone just kind of stays into this one little section over here, and you only talk to other people in our group, and you only engage in people in our group, and you don't get to mingle with other people. So their separation is, what they did way back when, where people with mental health challenges were just kept completely apart from society. And then integration allows them to live in the community, but not really take part of the other things that are going on around them. And inclusion, which is what we are striving for, allows everyone to really be a part of their community, to be contributing members, to give and receive from their communities. And that's the difference for the It's My Life approach. Many programs have attempted to provide people with social skills training, but most have limited success in really connecting people to friends and community. The It's My Life program is designed to fill that gap that exists in the current system. So participants benefit from having creative ways to increase their self-esteem and self-worth and improve their overall function with networks that include supportive and sustainable relationships that will increase their quality of life. We really focus on the natural supports, really building natural supports more so than having paid professionals, being able to have that step-down process. It's My Life also provides financial support to participate in activities that the people would otherwise not be able to afford. We define community inclusion as the opportunity to live in the community and be valued for one's uniqueness and abilities, just like everyone else. To promote inclusion, we need pathways from segregated service provision into mainstream services, groups or activities solely for persons with mental health problems. They reinforce segregation unless they're part of a supported pathway into mainstream services accessed by everyone. There are 4 basic principles of community inclusion. We're going to look at them. First is rights, shifting from least restrictive to most inclusive. And that's a growing federal mandate. Many programs and even federal laws are shifting in that direction. Roles, number 2. Rights and responsibilities must be viewed across a wide range of domains. So really allowing people to be contributing members of their community as they see fit and as they're comfortable. Responsibilities. Community inclusion implies that a consumer's, pardon use of the term, assumption of varied responsibilities. And 4 is about choice, responding to each individual's set of community inclusion priorities and concerns about the pace of change. So we're going to do a brief review of the It's My Life program, kind of how it works and what are the components, as we have several people with us today who were not able to join us for part 1. So we're just going to do a quick refresher here. The program is an integrated skill support strategy and emphasizes that autonomy and self-management are not just for those who are, quote, doing well. It's for everyone. Everyone can benefit from having a say in their own recovery and their own growth process. So the innovation in It's My Life includes 2 evidence-based practices, which are peer support and psychiatric rehabilitation, the emerging best practice of self-directed care. There's also individualized, person-centered, and strengths-based. And again, we provide the financial support to participate in activities that people may not be able to afford themselves. And that is done through a social budget that our organization or the operating organization provides. So this is an illustration of kind of how the whole process works. And we'll start at the base of the pyramid, which is the recruiting and training of the coaches. Our coaches were trained in psychiatric rehabilitation, motivational interviewing, peer support, and self-directed care, and life coaching. So those are the different components of training for our coaches. We studied through Boston University for psychiatric rehabilitation, and we combined all of these different skill sets to be able to provide services to our participants. And in recruiting, there was some criteria, being of age for consent, which was 18, and able to follow their particular plan that they helped to establish, being able to be responsible for their financial budget that was given, and willingness to participate in the program given the criteria and agreement from the very beginning. So from there starts the forming of the partnership, and that's where the coach really just gets to know the participant, find out what they're interested in, what their goals are, doing some goal setting and things of that nature. That happens during the forming of the partnership. From there goes the skill building, and some of these things take place at the same time. Learning the different social skills that a person would find helpful in a social setting. Things like communication, effective listening, distress tolerance, mindfulness, relaxation, self-care. Those are all some of the skills that the coach would teach the participant or help them to grow in those areas. And a lot of that was also done through the outings. In the original It's My Life program, the life coach would go out into the community on social outings and activities with the participant to provide support, to provide feedback, and also to model appropriate social behavior. So they would connect with each other, spend that time with each other, and really start to learn and be more comfortable in the community settings of their choice. So those are the outings that took place. The budget that comes into play here, $60 a month was the budget that we provided to our participants to be able to go on these various social outings that they otherwise may not have been able to do, partly because of finances, sometimes because of transportation, and then also just because they may not have felt comfortable and may have been alone or just not really ready for it by themselves. And so we wanted to be able to provide that support as well. Then last we have our outcomes. And there were several measures that we used for our outcomes to determine the success of our program. The guided journals, where participants would journal each week to talk about their events, their outings, their relationship with their coach, the skills that they've used, and what their experiences were like, what they've learned, and what they would like to learn as well. We also used the Personal Outcome Measures survey tool, which was a way to look at quality of life. It's a quantitative measure of a qualitative event that we're looking to measure. So those are the things that we looked at. We also had satisfaction surveys so that our participants could tell us what they felt was going on and how they felt the program was helping them. And the last thing that we measured, of course, was the hospitalization rates. And I'd like to note that these were the only two things that we had in our program that was clinical. One was the hospitalization rates, and two was diagnosis. We focused in our pilot program on women with schizophrenia or schizoaffective disorder. The purpose behind that was to know that we were working with a population that tended to have the most difficulty with social interaction and faced a lot of isolation and social exclusion. So we knew that if we could work with the most challenged population, then surely our approach would work for those with less complicated challenges. So that's why we focused on those with schizophrenia or schizoaffective disorder. But of course, we know this approach will work for anyone at any level of recovery struggling with any particular mental health challenges. And then, of course, last is our results. which were just completely phenomenal. And I'll just share one particularly with the hospitalization rates, which a lot of folks look at because they want to know about the cost savings of a program. And in this instance, amongst all of our participants, there was a total of 19 hospitalizations for the 2 years prior to starting the program. Amongst everyone, we polled them, of course, with their consent, and there were a total of 19 hospitalizations within the past 2 years of starting the program. Now, 1 year after the program had started, only one person experienced a single hospitalization the entire time, and none of their other services had changed prior to enrolling in the program. And so we can conclude that our program had an enormous impact and effect in the lives of these individuals. So we're very proud of that, and we are very excited to know that this could make such a big difference for so many people. So we're going to look at some of the differences now with the new peer partner model and how it's separate, how it's different from the original approach that we had for the It's My Life Social Explorations program. So It's My Life, both the original model and the peer partner model, are designed to be a year-long program. In the peer partner model, instead of meeting one-on-one with the participants, the peer life coach now meets with the group of participants on a weekly basis. And during this time, the initial meetings, they include working on goal setting, skill building, and budget planning. Those are the same things that are covered in the initial enrollment for the It's My Life Social Explorations program. So that part does not change. The focus on goal setting, skill building, and budget planning, those are still our beginning stages, as well as building rapport and relationship. So each month, though, the meetings will focus on a different theme or skill category. And there is a schedule that we have actually set up for that, which we'll look at momentarily. So the meetings are held weekly, and each meeting is scheduled to be 90 minutes. And it consists of the lesson plan on a skill set of the focal category, and then it's followed by a group discussion on the experiences with that skill. So participants will have opportunities to give and receive feedback from both the life coach and from their other peers. Between meetings, the participants are asked to try out these skills with what they've learned and to try them out in the community as they go about. So each week, the peer life coach will select a lesson plan for the meeting that focuses on the specified theme based on the theme schedule, and it's also flexible enough to be tailored to meet the needs of the group. So this is our basic schedule of themes for the program. As I said, it's intended to be a year-long 12-month program. So as the program begins, the first month focuses on introduction and goal setting. And the first month is really essential in the peer partner model because that's where the participants get to know each other. It's also where they start to learn more about themselves and establish a rapport with the life coach. So during this time, they start to establish what they're interested in, learning more about what they like to do, and getting ideas for their social activities and their outings and hobbies and interests that they'd like to pursue. So during this time, the coach is helping to look as they are preparing to partner with another member of the group, because that's the person that they're going to be going out into the community with in the peer partner model rather than going out with the life coach. So again, to clarify that, instead of going out on social outings with the life coach, as in the original model, the peer partner model is such that two participants will partner with each other to go out into the community for their activities and outings. So the focal theme schedule is here, focusing a lot on self-care, communication, coping, thoughts and belief patterns, and then the last month focuses on coping skills and goal setting, and there's a process for transitioning out of the program as well, preparing to step down from having the support of the group and the coach and to be able to continue with the skills that they have learned. So during each meeting, it's essential that the peer life coach is attentive and in tune with the needs of the group and with the individual members. And that's going to be really helpful as they select lesson plans for each week to know what the group needs and what lesson to teach. Participants journal about their experiences, so our outcomes are measured the same way through the personal outcome measures, through the satisfaction survey, the journaling, and hospitalization rates. That's optional depending on the organization, whether or not they choose to track that. So with the journaling, they write about their experiences and share them during the support group portion of the meetings. We've also readapted the journal for folks to be able to draw, because for some people, they're more visual and prefer to express themselves artistically. And we want to make sure that we are person-centered in that way as well, for people to express themselves in the way that is most beneficial and appropriate for them. So by listening for overarching themes and common threads, that is how the coach selects the lesson for each week that most benefits the group. So clarifying with the peer partner model, each participant partners with another and goes together into the community on outings of mutual interest. So there may be a need here from additional support from the coach for scheduling and arranging transportation and just kind of getting comfortable with being able to do that. As participants begin to build new relationships, the peer life coach slowly and through discussion begins to lead the participants to decrease their reliance on their peer partner, the group, and the coach. So the end goal is for the peer partners and coaches to be supporters who are available when they're needed, but not the only persons that participants build friendships with. We'll look at some of the benefits of the peer partner model. And today we're going to look at both the benefits and potential challenges. So we'll start with the benefits here. One of the major benefits here is the exponential increase in the provision of peer support. The model just automatically provides that because of the support group format. So the shared experience of social challenges promotes a strong sense of compassion. And meanwhile, they get to observe others who are facing those similar challenges, and that normalizes the experience. To know that other people struggle with the same thing, other people have those same challenges, it's for me, it's validating. It's good to know that I'm not alone and it's not just me, and that it's okay, it's acceptable. Other benefits are that participants will be giving and receiving feedback from each other. So just another resource for folks to have. And oftentimes, this generates discussions where participants will highlight the successes of their peers and often overlook their own progress. They'll be able to say, oh, but you did so great on that. Well, did you notice how different you responded to the situation than what you did a month ago? But most of the times they won't see that progress in their own selves. And the awareness of this practice increases because the members of the group highlight that for each other and point it out for each other. They provide that accountability naturally and gently throughout the process. And as that happens, participants learn to recognize and celebrate all of their own victories. There are also positive financial implications to using the support group model, which was one of the main inspirations for us creating this model. Hugely, I would say, is that the cost of operating the program is greatly reduced by allowing the peer life coach to work with multiple people at the same time. So in our original model, the life coach would meet one-on-one with each person, and so would be able to meet with 5 or 6 people, during the week, and possibly all 10 participants at a time. But it would really take up a lot of time for the life coach, which could become quite expensive for the organization that's operating the program, and just the logistics and administrative details that come along with the one-on-one support. So using a support group model, working with all of the group members at the same time really reduces the amount of time that the life coach has to spend at that point. So the time and expense of funding the coach's travel, as well as participation in the outings, are nearly eliminated because the coach is not doing the outings with the individuals. The participants are doing the outings solely. So paying for that is no longer necessary, and that saves a great deal of finances for the operating organization. Additionally, the monetary benefits also can extend to the participants, as they can share costs for transportation if they decide to go on their outings together at the same time. They can ride together, ride sharing, and they can also receive group discounts if we have several members attending the same event. So looking at some of the challenges, when you're doing the group model, the group size is very important. The group actually needs to have an even number of participants so that each person will have a peer to partner with. When there is an odd number, you have someone left out, that can be addressed in a sense of having a group of 3 going at the same time, and that often works fairly well also, but it's more beneficial to have a pair partner. And as far as the group size goes, we recommend having at least 6, but no more than 12 members in a group. Something else to consider is logistics for the meetings. Location. You want it to be accessible for people, especially if they're using public transportation, as well as things like handicap accessibility, space if there's someone with a service animal, or wheelchairs, or things of that nature. Scheduling can be a challenge, just making sure that your facility is available, that is, again, accessible, appropriate for heating, ventilation, all those kinds of things need to be considered for the logistics of your meeting place. And, of course, it has to be maintained a physically and emotionally safe environment. And that's something also that we talk about in our training and in the resources we provide. One of the greater challenges is group dynamics, as well as through the peer partnership, the dynamics in that relationship. So there may be times when a peer partner team is not working very well together. So the peer life coach must be aware and prepared to address the potential impact of these issues on the group as a whole. And consideration of the male-female dynamic should also take place to avoid transference and countertransference whenever possible. In our pilot, we had only female participants because we happen to only have female coaches. But I imagine that with the peer partner model, there would be a co-ed aspect, which would be adding some need for additional consideration on transference and countertransference. And continuing with the peer partner and group dynamics, people progress at different rates, and that's something else to be aware of. So as I said, the peer partner team goes out into the community together initially on outings of mutual interest. Now, there may come a time where a participant seems to be growing in confidence and progressing further, and they're ready to go out on their own without their peer partner. So you'll want to be aware of that kind of thing. So it may be appropriate then to repartner, to repair someone who's kind of going on in that same stage as people start to progress and go out independently on their own. So that's the progression rate difference is something that has to be taken into consideration and also discussed with the group from the very beginning. Another challenge is the fidelity to the person-centered approach. It simply means that it takes a bit more effort to maintain this. So the decreased one-on-one contact is sometimes a barrier to making sure that everything is person-centered. So that'll come along with making sure that the relationship is strong between the peer life coach and the group, that the rapport is strong, and that they stay connected with one another and the communication is clear. So the relationship building can be challenged when there is not as much one-on-one contact. And that will be a skill set that the coach will need to develop in keeping those relationships strong. Selecting lesson plans, that's something that the coach will have to pay close attention to make sure that the lesson plan applies to the entire group, that it's something that everyone can benefit from, as well as adapting their teaching to the learning and communication styles of the group. When it comes to implementing It's My Life peer partners, the program is suitable to be run by peer-run organizations especially, as well as state mental health establishments, community service boards or mental health centers, various church or religious organizations, Mental Health America affiliates, as well as NAMI groups, and many, many other types. And I'd like to make it clear that with the training that Mental Health America now offers, we address all of the challenges covered in today's webinar. So the training that we offer is in fact free for our virtual trainings. We also have in-person available. So we offer technical assistance as well for the first year of implementation. So once the program gets started and your organization has implemented it, we offer technical assistance, and we will be here to support you the whole way through. So again, emphasizing virtual training is free. We do that through our webinar software so that your team, wherever they are, can simply log on to our webinar software through the internet and be able to access the training that we provide. It is very personalized to your group and what you need, as well as the flexibility of the schedule. We also provide training materials too. So flexible scheduling. I've actually also provided training to our first implementers of the It's My Life program, and that's the Mental Health Foundation in Scotland. So It's My Life has officially gone international, and so we even accommodated the time difference between Scotland and us here on the East Coast. So the flexibility is definitely there to meet the needs of you and your team. There's also an individual instruction session for the program directors. The role of the program director really cannot be overemphasized. They provide support for the life coaching team, and they also oversee the social budget and the other logistics of the program. So there are individual training sessions specifically for the program director, and then the other trainings are tailored to the life coaching team, where they will be able to ask questions and get support and have those things address any concerns that they have. Training kit is also provided that includes our latest manual for the It's My Life Peer Partners program. It also provides additional resources relating to support groups and facilitating them, This is an aspect that's not part of the original It's My Life program. And so we've created new and more detailed resources for support groups and how to facilitate them, the skill sets that are important to have there. So we identified the key parts of the training that our life coaches went through. We trained for several months, studied for several months on these different areas. And what we've done in our training program is isolated the parts that are most important to being able to be an effective peer life coach for the It's My Life program. So we've taken some of the key parts of peer support, and really with peer support, it all comes into play because the whole program is about peer support to make sure that it's a mutual relationship and not the traditional power dynamic that you would find in a doctor-patient role. We also talk about shared decision-making, that there are two experts in the room. So not only do we talk about shared decision-making as it involves in the program between the life coach and the participant, we also teach the skill set of shared decision-making to the participants so that they can apply that in their recovery with all of their service providers and just in their lives in general as a skill set to have. And as I mentioned earlier, we studied with Boston University, who are the founders of the Center for Psychiatric Rehabilitation. So in our training that MHA provides, we've isolated the key parts of psychiatric rehabilitation that applies to the It's My Life program. So a lot of the social skills, a lot of the skill sets that are required for independence and being able to build those natural supports. Those are the things that we've isolated from the psychiatric rehabilitation training so that your coaches don't have to go through the lengthy course that we went through. And that course is also quite expensive. So we've taken out just what you need, and we'll teach you just the things that you need to know in order to implement the program. We also talk about life coaching, another skill set that we used. And we really looked at becoming a professional life coach, lessons from the Institute of Life Coach Training. And that's a book and some resources that we looked at for life coaching. And life coaching is becoming a growing field. So we will, again, take a look at the things that are most impactful and applicable to implementing the peer partners model. And then lastly, of course, is motivational interviewing. And that's a huge piece. That kind of also includes the peer support aspect that kind of go together most of the time. So we'll look at motivational interviewing and how that plays a role in the peer partners program as well. So if you are interested in learning more about the It's My Life program, either model or the training, please do contact me. I am Siobhan Carpenter, again, the Senior Associate of Peer Advocacy, Supports, and Services here at Mental Health America. My email address is here. It's scarpenter@mentalhealthamerica.net. You can also text or call me, 703-946-0529. Again, that's 703-946-0529. That's also the email address that you will want to send your request to if you would like a certificate of participation for today's webinar. So as we begin to come to a close here, I want to come back to the question that I originally asked at the beginning of today's webinar, and that is, what is an essential, the top number one essential to recovery? Be it your recovery or someone that you know or work with, what would you say is the number one essential to recovery? And I did notice a couple of folks who had responded, If you've not responded to that question and you would still like to, please go ahead and insert your response into the chat box. I'd certainly like to hear from you as far as what you feel is the number one thing for recovery. I saw a couple of responses earlier, and someone said hope was the number one thing for recovery. And I think I saw two folks who said believing that you can recover. And so there's a reason that I asked this question as it relates to the It's My Life program. I was hoping we had some other folks to respond, so maybe I'll just give it a second if you want to add what is your number one essential to recovery. So someone said hope as the number one thing for recovery. And Jackie says open-mindedness, thank you. Angela says hope, thank you. Lourdes, support, thank you. Thank you all for adding that in. And it's not too late. If you think of something you want to add in, please feel free to do that. So we have hope, belief that you can recover, open-mindedness, and support. And the reason I asked this question is because I just knew that there was going to be connection with all of these things and what our program focuses on. Amongst all of the responses and feedback that we got from our participants throughout our program, these were common themes. These were things that our program helped to establish for people. Many people in our program really expressed from the beginning that there wasn't hope for them. They weren't sure that they could recover. They had reservation about joining the program because they felt like it was useless, it was hopeless, and nothing would make a difference. And I can say for myself, that is something that I have experienced. And those things have changed even for me as a coach in this program. And I want to read to you just a couple of quotes that we had from our participants in their journals and from the personal outcome measures interviews that we did with them. One participant said, "It brings tears to my eyes when I think about this program. It is like a revival for me." And for her, she was talking about her hope being revived. It was like coming back to life for her. And I think I may have shared this in our part one. But she's the young lady that went to Starbucks for the very first time. She was in her 50s, and she had never been to Starbucks. And so just that one time, we went there and we sat down and had a cup of coffee, and she literally cried. And I asked her what was wrong, and she says, so many people do this every day. So many people come to Starbucks, and they sit here and they have their cup of coffee, and some people have it more than once a day, and I've never been able to do this. And that was just something new for her. It just really opened her eyes and gave her a fresh start. With Jacqueline said open-mindedness is essential to recovery. An example of open-mindedness that happened in our program was a young lady who said, quote, "I have learned that people can be friendly and good-willing." She didn't believe that before. But through the program, with her interaction with other people and getting to know people and talking with them and having the courage to be able to do that, her mind became more open and more able to get to know people. She's the same person who said that I used to wait for people to talk to me, but now I start the conversation. And that's a growth for her that she didn't have before. And I say Lourdes is for last, support. Indeed, support is so important for recovery. I think I would have to put that at the top of my list when it comes to an essential for recovery. One of our ladies, she quoted Confucius in her journal. She says, Confucius said, "A day without people is a day without growth, and this program helps me grow." And I just thought that summed it up so very, very well. It was just beautiful. Just how important it is to feel connected to people, to feel like you're not alone. And in that, I actually just remembered one of the other benefits from the program that the new model, different from the original, that I wanted to highlight. In the partnership, in the group format, in people coming together, all of the participants coming together, there was expressed interest amongst the participants in the beginning in our pilot program who didn't know each other. They had not met each other. They were not engaging with one another, and they really didn't have any contact with each other until they expressed, "I want to know what others are doing. I want to know what the other ladies are doing, and maybe I can get some ideas from them." So in that, we arranged a couple of different get-togethers, couple gatherings, a luncheon for all of the ladies to come together and share with each other and bounce ideas off each other and, maybe find some inspiration. So in doing that, 3 of the ladies communicated with each other at this outing and found that they had a common interest of going to the circus. And at that time, they connected with each other and contacted me, and we actually arranged a day at the circus. And that was something that wouldn't have happened before if they had not met with each other, if they had not shared those ideas with each other. And so with the peer partner model, that can actually now happen all the time. They have that additional benefit each week of being able to share with each other and to share resources with each other as they begin to learn what's available in their community. They can share with each other what those things are. So those are actually a lot of things that can be essential to recovery: resources, hope, belief that you can recover, open-mindedness, and, of course, support. So the It's My Life program, both the original and the peer partners model, are designed to be able to facilitate those things. So as we close, I would like to announce part 3 of the webinar series, which will take place at 2 p.m. Eastern Standard Time. Daylight savings is over. So 2 p.m. Eastern Standard Time on Thursday, December 7th. So what we'll look at there, we will take a closer look at the tools and innovation involved in the It's My Life program, particularly the psychiatric rehabilitation, peer support, life coaching. We will look at all of those things more closely, and self-direction, of course. We'll learn more about the training that MHA offers to organizations desiring to implement the program. We can look at what it takes to get started with implementing the peer partner model. So what you would want to have in place and all of the things that you would want to consider before getting started. So that will be our focus for the next webinar. Again, that's 2 p.m. Eastern Time on Thursday, December 7th. Registration will be available right after the holiday weekend. So please do keep a lookout for that announcement as it comes forward. And Mental Health America would like to thank our program sponsor, Jensen, for providing the grants to train other organizations to end social exclusion and isolation through the It's My Life Social Explorations and It's My Life Peer Partners programs. We are grateful for their support because it allows us to provide these trainings free of charge to organizations so that this just remarkable program will be made more available to people who need it. So thank you, everyone, for joining us for Part 2 of the Peer Partnership in Recovery and Social Inclusion webinar. And again, here is my contact information if you would like a certificate of participation. Thank you, everyone, for joining us again, and for those who have contributed to the conversation. I really do appreciate your presence and participation. I look forward to hearing from you, and I hope that if you are interested in the program that you will not hesitate to contact me. I'd love to set up a conference call with you if you want to talk with your leadership at your organization about getting this started in your locality. Again, I'm Siobhan Carpenter here at Mental Health America. My email address is scarpenter, that's SCARPENTER @mentalhealthamerica.net. Again, this will be available, the recording, on our website, and we look forward as well to having you join us for Part 3. Thank you so very much, and have a wonderful day.